Going. Hi, welcome. This is Joseph with team at Skin Perfect Brother with VLA Aesthetic at Walnut, and here is nurse practitioner Amy. So we're going to do a global assessment. The basis of aging is volume loss, and it shows up as several signs. Number one, as we age, Amy's going to draw on or kind of outline the face. We tend to see three lines of aging. One is here, the tear trough. Second is the laugh line. Third is, they call it the marionette line. And as we age, we tend to notice these two fat pads. One is nasolabial. Second is the jowl fat. Thirdly, we tend to see concavities or holes. One is horizontal across the forehead, right here. Second, it's in the middle. Third is on the side. And as you can see, these movement away from ideal proportion of the face can be corrected using the VLift technique, among others. And I'm going to show that. Annie, go ahead and talk about the lateral aging in terms of the concavity that we could see.
So you get hollowing on the side of the face as well. I think that is due to volume loss on a bone level, muscle level, and a fat pad level. So you get a temporal hollowing, you get a preauricular hollowing, and either people can have both ways, but you get a presal sulcus where you actually get a bone reabsorption, and also you get a hollowing again in the mid-cheek area.
And thank you. And the second part of the global assessment is looking at the face in terms of the 5 eyes across and 1/3. In this patient, we call it the power slim assessment, where you notice that the face becomes more round, and we could make this more chisel, more slender down here by doing a few things. We could do a little bit of the toxin here to shrink the masseter, decrease jowl fat there, and chin fat using Kybella, and also doing some extension of the chin, as you could see from this photo to that photo. And what is the third, when you look at the face, what's the third part that you look for as you turn the face into a profile view?
So when you're looking at the face on the side profile, you're looking at the projection and kind of alignment of where the projection lines up. So first part will be forehead. You want to have a nice and full forehead and without not much concavity. That's how we're born when we're young. Balloons is nice and full. And also I usually look at the nose, how much projection you have. You want to have little projection nose, which can also make your face look slender. And also lip and chin kind of lines up together as you draw a line from nose, lip, and chin. So when I'm doing a lip filler or lip assessment, I make sure the chin appears to be strong enough or there's no retrusion or weakness.
Thank you. And a lot of patients will come in and say, I feel a little bit flat as I turn. And so there are several areas of flatness that develop as we age, as Annie mentioned, and all those could be projected. So turning a flat interior surface to a more 3D projected feature. Okay, so we're gonna begin we just finished a global assessment. We're gonna do regional assessment. Today we're just gonna focus on the forehead and we're gonna move down to the brow. And the way we're gonna finish in 2 minutes, and there's gonna be 3 parts. Number 1 is assessment. Number 2 is injection and design. Number 3 is consult and sales, like how much does it cost for patients. So a lot of patient comes in and said, you know, I noticed there's a little bit hollow here in my forehead region, And as you could see before and after, this is fully volumized. Yes, you could place filler in this region with a lot of care. You could do a good job. So the first part is anatomy assessment. When you peel away all the layers, what you see is there's this concavity naturally in most people right here and right here on the side in the middle. As we age, the area loses fat and tissue and it kind of caves in. So knowing these three hollows of aging or concavity will help you to quickly identify where to treat. Second, design and assessment. The way we volumize that area is using a cannula, 25 gauge preferably, and take a horizontal to lateral approach. And what is the level? Would be on bone. Paying attention to some of these important vascular structure that connects into the eye. You want to avoid those. Make sure your fingers are on it. And number three, console cells. We like to, for beginners, use very soft product like Ballatero or Labella. And you could pretty much play 1 cc of the product in most patients into this region right there and a little bit in the upper temple. And that'll give you a really nice full rounded look. And how much does it cost? Well, each vial comes about 700. You could do 2 vials, that's 1400. Patient could get a discount. And lastly, I'll finish with this. Some of the side benefit of filling this is you could perk up your brow. You could help forehead and temple have a smoother transition to avoid the skeletal look. And you can even improve the eye area when you put fillers in the forehead down to the temple region. And that is it. Thank you for joining us today. We'll see you soon.
Bye.
Bye.